Hi everyone, my name is Jennifer Wingertson and today I'm going to talk to you briefly about the current opioid epidemic. I will highlight how this crisis has affected the state of Georgia, including the population of Lowndes County. The United States is in the midst of a nationwide public health emergency, an epidemic of opioid misuse and abuse that has been called the deadliest drug crisis in American history. In 2017, President Donald Trump declared the skyrocketing opioid crisis a public health emergency. The reason for this is because the number of opioid-related deaths have increased tremendously over the last 10 to 20 years. Over 191 million opioid prescriptions were dispensed in 2017 alone, and once addicted to these dangerous drugs, it can be a monumental feat to stop. Just like any other disease, addiction is also that in itself, and this deadly epidemic needs to be spotlighted for surveillance, prevention, and education efforts to be successful. So, what is the problem exactly? As the statistics previously mentioned point out, the number of opioids being prescribed is abundant, and this has unfortunately led to harmful addiction and one too many fatal overdoses. The opioid crisis has made itself known all over the country, and the state of Georgia is no exception to this. Between 2010 and 2017, Georgia experienced a 245% increase in the number of opioid-related overdose deaths. This is due to a combination of prescription painkillers, synthetic opioids such as fentanyl, and heroin. Opioid misuse has devastated countless lives and torn apart many families, and something as simple as a legal prescription for pain medication can turn into something more sinister, as it has for many. Misuse and overdose do not discriminate, as this crisis affects mothers, fathers, sons, daughters, doctors, nurses, teachers, and anyone else for that matter. Opioid misuse is present everywhere, but it seems to be more prevalent among the white American population. This also holds true for Lowndes County, as according to the Georgia Department of Public Health's Online Analytical Statistical Information System, or OASIS tool, between 2015 and 2019, there were 19 opioid-related overdose deaths for white Americans, 2 for African Americans, and no deaths reported for other races. Research has indicated that this disparity is in part due to a racial pattern, if you will. Historically, the white American population in the United States has had better access to health care, which means a higher proportion of the white American population has had increased access to opioid prescriptions. While the data that has been presented addresses Lowndes County, the opioid crisis is affecting the entire state of Georgia, as well as the country as a whole. Opioid misuse does not discriminate and affects both wealthy and poverty-stricken neighborhoods, workplaces, schools, and more. Opioid misuse can be found anywhere and everywhere throughout the community. There are some resources available for substance abuse in the local area, but for the most part, the availability of appropriate treatment and services is limited. In addition to this, many facilities require either health insurance coverage or the ability to pay out of pocket for treatment costs, and unfortunately, these financial barriers prevent many from seeking and receiving appropriate care. There are currently not any public-funded resources for opioid abuse treatment and recovery in the local area, mainly due to a lack of funding and resources, and community outreach has also been lacking as of recent due to the COVID-19 pandemic, as well as a lack of robust data on the burden of opioid misuse and overdose in our community. As with any public health concern, strategies should be put in place in order to address and curb the rising opioid crisis within the Lowndes County community. These strategies include improving data surveillance to more accurately capture the opioid misuse and overdose burden in our community, building and strengthening partnerships with hospitals, first responders, and other stakeholders in our community, and ensuring open communication. It is also critical that education be highlighted, as this serves as a way for the community, first responders, and other stakeholders to realize the magnitude of this dangerous problem in hopes to reduce and eliminate misuse and overdose. Prescribing practices must continue to be cautious and restricted, and this has been positively impacted by implementation of the Prescription Drug Monitoring Program. Harm reduction activities should also be a focus, as this is an important strategy in reducing stigma and extending a helping hand towards treatment and recovery. Communication is key when facing a significant public health issue such as this in our community. Current communication strategies include collaborating and developing partnerships with hospitals, other healthcare facilities, pharmacies, first responders, and other stakeholders. Communication with these agencies must be open, unified, and transparent. Communication with the public is also paramount, as members of our community need to be made aware not only of the threat of this growing problem, but how they can overcome addiction themselves, as well as help family, friends, or coworkers who have been impacted by the opioid crisis. Thank you very much for your time today, and I hope we can all work together in order to change the outcomes associated with the current opioid crisis.